everyone. I am Dr. Vanshika Aggarwal, and that little girl on screen, that is me. I was a very happy, chubby kid who loved candies, stories, and performing. I was born in a small town in India called Yamunanagar. Life was very simple there, no complexities at all. My mother says that I came into this world with too much energy and maybe even too much sugar, I believe. But when I was six, something happened that changed my entire world. During a school annual function, my costume did not fit. And the tailor said, "It's not the costume. Maybe you're just too fat." Imagine being a 6 year old child already being subjected to body shaming. I took it to heart. My mother believes that moment, that shame, triggered my autoimmune response. Even before diabetes entered my blood, stigma entered my body. 18th July 2007. I was 7 years old and I still remember that day precisely. I was drinking too much water since a couple of months and my parents took me to a doctor and they casually mentioned about it. And voila, my sugar level was 357 and my HbA1c was 13. That day, it changed everything. My family's world came crashing down. I still remember my extended family was gathered in our living room. And I, being a 7 year old, couldn't comprehend what is happening. Why is mom crying inconsolably? My aunt took me to the other room to feed me, and I kept asking her, "What happened to mama? Why is everyone here? What is happening?" My mother was inconsolable. She cried for weeks. He lost around 15 kgs of weight and started looking like a ghost. My father silently kept us together. He learned how to manage my sugar levels. He learned how to inject. And that too when there was no endocrinologist in Yamunanagar. I was visiting a physician who told my mom that she would never be able to become a doctor because diabetes is taxing and medicine requires dedication. God. We used to travel around a lot to see endocrinologists in other bigger cities. And one day my mom was asking my dad, "What should I tell her teachers?" And my dad laughed and said, "Tell them that my little sweet potato got a little too sweet." I have an elder brother. He was 11 back then, an 11-year-old child who needed attention and love himself. He became an adult overnight. He became a guardian to me. He has always been more like a father than a brother. He reminded me to eat. He checked my sugar levels, stayed by my side, told my teachers how to manage my sugar levels. We weren't a family with diabetes. We became a team. But the world outside, it wasn't too kind. People started visiting the diabetic girl like I was some exhibit which they have never heard of. They started saying things like, "Who is gonna marry her? It's her mother's karma that she got diabetes. Oh, you must have eaten too many candies that you got diabetes." They said things like, "Do not inject her too much insulin, huh? She will get addicted to it." My parents were blamed. My mother, she was shamed. But instead of anger, my mother chose knowledge. There was no internet back then. We didn't even have a computer at our home. He started asking around friends and family, asked them to get her research papers printed. He used to stay up all night going through all of them, learning about insulin, latest technology and research, management practices. He became my first diabetes educator, even before I knew this term existed. And that's when I realized when systems fail, love becomes science. Teenage years, they are meant for discovery. But for me, they were about denial. I was tired of being the diabetic girl. I started hiding my condition. I started lying about my glucose levels. I stopped taking my insulin doses. I used to quarrel with my parents if they told someone about my diabetes. I wasn't rebellious. I was just scared. I was tired. I felt different. I felt unseen. I was scared of being judged. My parents, though, they stood by me. They were patient with me. They were kind to me, even when I wasn't. Denial, I've learned, isn't disobedience. It's pain that haven't found words yet. And mine, they finally did. But after many, many years, the year I was reborn, 2019. So I got a typhoid infection, which went undiagnosed for 3 weeks. And by the time I was hospitalized, my A1C was 11. My body was failing. I had pleural effusion, abdominal effusion. My body protein levels were nil. My spleen was enlarged. Kidney and liver were failing. And I couldn't breathe without oxygen support. Those 8 days, I lay in that grim room, contemplating everything I have been doing, all my life choices. I saw my mother smile through tears when she was wondering, unsure of my survival, if I was gonna make it, if I'm gonna make it out of this hospital room. My father, as you can see in the picture, is laying with me in that hospital bed. And my best friend Bhavya, she visited me during Christmas and New Year's. They stood beside me, smiling, holding my hand when I was crying out of pain, when I was continuously injected with precautions. And on the sixth day, my doctor, being very angry and frustrated because of my deteriorating condition, barges in the room on a weekend when he was supposed to be on and off. He comes in, starts yelling at me, Vanshika, you are going to be a doctor one day. I cannot expect healthcare professionals like you to be this irresponsible. If you are acting this way, how are you going to tell your patients to take care of themselves? And that moment, that scolding, cut through all of my fog. The girl who was in denial died that day, and a new Vanshika who chose responsibility, who chose accountability, was born. After recovering, I knew I just couldn't go back living passively. If I were at that position, there are a lot of people who are feeling the same way that I did. So I started working with an organization which worked for people living with diabetes. I started working at the grassroots level. I found my community, people who resonated with me, the people in front of whom I felt seen. I started conducting awareness sessions. education sessions, and meetups as well. Yamunanagar being a very small town, I started talking about diabetes technology. I was the first one to wear a CGMS and tell people about it in the awareness session, which you can see a picture of on the screen. And this photo with the little girl, it says, I love you, Didi. She drew it for me, which means I love you, my dear elder sister. I saw myself in that little girl, but she is my confident, fierce, darling baby who sported her CGMS and pumped confidently. I so wish I was that way when I was 7. But I believe this is now my mission to make every child feel that confidence. All this time, I've realized advocacy isn't about big stages. It's about those small conversations where someone feels heard and seen because of you, where they feel that they can be themselves and they're not different. In 2022, I finally became Dr. Vanshika Aggarwal. The same people, the same girl people told that she couldn't, she cannot. Oh, I did. That degree, it's not just a paper to me. It is a proof that chronic conditions doesn't define destiny. Anything doesn't define your destiny. Whatever you dream, you're capable of achieving it. My mother's dream came true that day, and I realized I wasn't just living for myself. I was living for everyone who has ever been told that you cannot, because all of us can. In 2023, I graduated from King's College London with a master's degree in global health. Small town girl who was told that she cannot do it, who was unable to find an endocrinologist initially, was now studying global health systems in London. Most of my research was centered around diabetes as well. I researched the impact of COVID-19 on diabetes management in India. Additionally, I worked for the research group which focused on stigma and gestational diabetes. Along the way, I understood that healthcare isn't about just science. It's about equity, it's empathy, and it's inclusion. When I walked down that stage, when I walked down my graduation stage, I looked at my parents and there they stood, all proud and googly. And later, my mother whispered in my ear, see, I always told you, we are chosen for certain things for specific reasons. You were chosen for it because you were made for greater good. You were made for great, great things. And that sentence has become my reality. Throughout my life, I have tried to live by it. This is my Daya family. The people who I cannot imagine my life without. My soul sister, my best friend, my mama bear, my biggest cheerleader, Diksha Dev, and our dear, dear best friend, Ankur. Together, we are the Daya tribe. We laugh, we cry, we advocate together, and sometimes just exist in silence. Look at this. We even got matching tattoos, three blue hearts. A reminder that sometimes things we think are a curse give us the most beautiful gifts of life: love, friendship, belonging, and a purpose. This right here is my strength, my mother, the woman who has done everything for me. The women who taught me not just how to live, but how to fight. When I was diagnosed, she broke down, but she rebuilt herself stronger, wiser, and unshakable. People told her that maybe it's your karma. She said, no, it's my calling, it's my journey, it's our journey. She fought stigma with science. She turned her fear into her faith. Sometimes I ask her, Mom, you're a little too optimistic. She smiles and tells me, life gets easier and happier when you start finding the good in everything. Her faith, that is my anchor. And as cheesy as it may sound, her love has always been all of my medicine. If I am anywhere in my life today, I owe it all to her. It's because she stood first. It's because she fought first. Back in 2021, I told Diksha one day, we should do something bigger. We need to build something of our own. And she told me, we are going to do it one day. And she did it. In 2025, she launched the Alignia Foundation. Our mission is to make mental health a pillar of chronic condition management. Because no matter how advanced technology gets, no insulin pump, no technology can manage fear, burnout, and moreover, shame. At Alignia, we focus on research, advocacy, and awareness as well. We work to ensure that care systems understand the whole person and not just the condition. Healing begins when people feel heard. And mental health, it's not just optional, it's essential. There is no care without mental health care. This photo right here was taken in a very, very small remote village of rural Uttar Pradesh. No internet, no network, no comfort, and no connectivity. Yet I manage my diabetes just fine while working on maternal and child health projects. People once said you wouldn't be able to do it. And I said, watch me as I do it. I believe that is what thriving looks like. It's not perfection. It's persistence. And it feels like life has come a full circle of everything that I am. Strength, joy, and love. I often think of that 7-year-old girl, the one who couldn't fit into her costume, who thought she was too flawed to do anything. If I could go back, I would tell her, you're not broken. You are just starting to become what you're meant to be. Because diabetes didn't take something from me. It gave me everything that I stand for. It gave me purpose. It gave me empathy. It gave me community, all of you, the people who I even haven't met yet, but I know we are connected because of one bigger purpose. We don't need to fit into systems. Care systems need to fit us. And if there's one thing I want to leave you with, it's my mother's words. We were chosen for this journey because we are strong enough to walk it. Thank you.